I'm David Patton with Fred Hutch News, and I'm here to meet the Greek. And that means I'm talking to Dr. Petros Grivas, an oncologist with expertise in treating genitourinary cancers such as bladder cancer, prostate cancer, and testicular cancer. He sees patients at Fred Hutch's Sloan Clinic in Seattle and leads research and clinical trials that investigate the use of immunotherapy for GU cancers. So Petros has a new role as medical director for both local and regional outreach as well as Fred Hutch's international program. And in this new role, it really recognizes your enthusiasm for talking to folks, from patients to peers, about the latest developments in cancer research and care. And so today we're going to have a discussion that really kicks off his podcast, where he'll be talking to other Fred Hutch experts. So, Petros, what inspired you to start a podcast?
Thank you so much, David, for having me here. And I'm so excited to work with you and this great team at Ferhat. We have such a wonderful, amazing team broadly here at Ferhat on Cancer Center at University of Washington. And the main motivating factor for me is I want to learn more from my colleagues. I want to understand what brought them here in this beautiful city of Seattle and what made them be part of the Ferhat family and community. We have a diverse group of experts across different parts of the world coming together, trying to take care of patients, improve outcomes, help people live longer and live better with better quality of life. And all of those colleagues share their stories. So I want to learn these stories and understand better their research, what excites them in the day, what keeps them up at night in terms of research ideas and clinical trials that may be promising for patients and bring, new ideas that can become the new standard of care in the future. And hear from them why it's important for patients to consider Ferhat as a destination for cancer care and treatment.
And so, who are you hoping will tune in for this? What's your audience? Is it clinicians or researchers or patients? And how are you going to tailor the conversation so that it kind of matches that audience?
Absolutely, David. Great question. We live in a world with a very diverse audience, right? We have, of course, first and foremost, we think about our patients, in our day-to-day work. I can see patients and patient advocacy groups being part of the audience here. I know that patients and patient advocacy groups want to hear what is innovative, what is going on in the forefront of research, which innovative clinical trials perhaps may be able to offer for our patients. And I think that's definitely some that motivates me every day. And I want to make sure that we have applicable content for our patients. Another big part of the audience here is our colleagues and friends in the community. There is no doubt that the vast majority of patients are being treated in the community practices. And I always respect and admire our colleagues in those community practices because they treat so many different cancer types. They treat, multiple different, cancer forms, and we all learn together. So we can learn from them and also help them in particular cases. They reach out to us commonly to get some advice about particular cancer types because we have expertise and experience with particular treatments. So I think community oncology colleagues and friends can be part of this audience here and, try to understand who we are and what we try to do, what's our mission, what our trials are, and keep the partnership. I always think that community oncology colleagues are great partners, equal partners in that, common mission and vision of cancer care. So I think they're definitely part of the audience. And, there's no doubt, invariably, there's so much, to talk about for the broader community. I know there are industry, colleagues, there are people, working as in a pharmacy, nursing team, advanced practice providers, other providers, physicians, not necessarily oncologists, but they want to learn about oncology. So I think we're going to have definitely a diverse audience here. We try to catch these different audience phenotypes, by having digestible content and try to make it easy for people to follow through.
So, I know a little bit about you, and I know you would love to talk to everyone here. How have you started thinking about who are the first folks you're going to talk to? What kind of information are you hoping to draw out, at least initially?
Absolutely. And this is one of the hardest things, to be honest, David. To have so many amazing, talented people here at the Fairhats, and it's impossible, of course, to interview every single one of them. I would love to, and I would love to get as many as we can working together with you and your great team. I think about this and I say, let's, get the process started, and then we can try to go around the different service lines, different cancer types, talk, with clinical research directors, clinical directors. I want to highlight junior faculty. I want to also, help with their career development. I think, having this podcast can help individuals, realize their scope and also talk about themselves. And I want to make sure we cover extroverted people like me and less extroverted people, right? And have a gamut of different participants. So we're going to start with some colleagues who I had actually the chance to talk about this idea, and I asked them for their feedback. And when I was doing that, I said, you know what? Thanks for your feedback. It's very useful. Let's have you being, in the first batch of those colleagues, individuals who participate. So we're going to have amazing folks being part of this podcast, and we're going to have fun. I tell them this is not going to be a stressful event. On the contrary, it's going to be a fun event. We're going to talk about life and science and research and patient care and, motivation for the future, how the cancer care looks in the next 10 years. What are the important trials you're doing? And tell us, about, other initiatives that you're doing. How can you mediate, programs that can help with toxicity management, right? How to manage side effects. How can we talk about quality of life and have like a broader approach? So I'm very excited. I cannot wait to start interviewing colleagues and friends here. And with your help, hopefully we can go around that virtual room, I would say, and interview as many people as we can.
And it sounds like you've really thought about, I mean, one of the experiences I've had here is that oncology is a specialty. And within that specialty, we have tremendous narrow specialties. And you've really thought about how to make this appealing to a larger audience by bringing in those individual conversations. Is there any particular topic that you're really excited about that you want to kind of tackle first?
Absolutely. We have many programs that are being under expansion right now. And one of the programs that came to mind was the head and neck cancer research program. And one of the first participants in the podcast is Dr. Tina Rodriguez, who I'm going to interview in a couple of days. This is a new thing, and I want to focus on changes and developments and what is new. And head and neck has been part of the amazing and wonderful thoracic head and neck program. And now is, developing its kind of, a further identity. So I was trying to think about how can we spotlight those initiatives we have at the Hutch. So that's one example. Of course, we have many other examples. We recently had the fantastic neuroendocrine symposium here, led by my colleague, Dr. Schweizer, in the GU group and others. And I was thinking, who is involved in neuroendocrine cancers? And it's an important, disease type that spans across different service lines. We can have gastrointestinal, and also genitourinary origin. So I'm going to invite Dr. David Zen. I call him the neuroendocrine guy. He calls me the Greek bladder guy. So we're going to have that funny dialogue with him. And we're going to talk with him also about gastrointestinal, GI medical oncology, and what is exciting in that field. There's so much going on. The other thought in my mind, David, is we have so many conferences and meetings going on. We have the European Society of Medical Oncology, ESMO meeting coming up next week. We have the cooperative research groups. So I'm trying to also get themes from those meetings when we have the new forefront of research and being presented, practice change in clinical trials that can be applicable to community oncologists. And also this can tie in with which trials we're opening here at the Hutch. I think that can be applicable again to all the audience, participants, right? What is important for patient care, what is important, for clinical trials, and also the aspect of education and research in general. We have such a multifaceted program here at the Hutch. And of course, education is part of what we do. So I'm also looking, at the trainees out there, right? The fellows, the residents, students, people who can be hopefully inspired to follow a career in medical oncology and beyond. And also, showcase, what's important to think about the career in oncology, think about our educational mission here at UW and Hutch. And in that note, David, I was thinking, can we think about the multidisciplinary aspect of care, right? We have such amazing talent, not only in medical oncology, but in radiation oncology and surgical oncology and radiology, pathology, so on and so forth. So I'm thinking about giving the podium here to colleagues across different disciplines and have a broader spectrum just to, broadcast how important for the patient is to have a team of providers in a multi and interdisciplinary model of care.
This sounds fantastic. We're so excited to have you do this for us or for Fred Hutch. And I think in the next coming weeks, you'll see the first episodes, and it's just going to be terrific for all the audiences you articulated and to see some more folks out there talking to you and having you bring out their stories. So thanks so much for doing this.
Thanks so much for partnering, David, and your amazing team. It's great to work with you, and I think we are going to get feedback. We're going to launch this idea. I always think shoot for the stars, go to the moon. So we can follow that principle. We can try to get better over time and use feedback to keep refining our mission and help our audience understand better what we do, and also try to be of better service to them.
Fantastic. Thank you so much.
Thank you.